Extract 1. Questions 1 to 12. You hear a dermatologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. Andrew Albourne, a dermatologist. Could you describe what's been bothering you?
Good morning, doctor. I've been dealing with some really persistent issues with my nails. A few months ago, I noticed that my nails started looking a bit odd. It began with a faint discoloration under the edge of my left thumbnail, like a yellowish tinge. Honestly, it's becoming quite distressing. I didn't think much of it at first, but now it's spread to a few other nails. They've become brittle, thicker, and oddly shaped. Sometimes, parts of the nails seem to lift off the bed entirely, and there's this strange chalky debris underneath.
I see. Is this affecting only your fingernails or your toenails as well?
Both, unfortunately. It's worse on my toenails, especially the big ones. The skin around them feels inflamed and tender at times, particularly after wearing tight shoes or walking long distances. And there's this embarrassing odor. It's not overpowering, but it's noticeable.
That does sound troubling. Can you tell me more about your overall health and lifestyle?
Well, I try to stay active. I go to the gym about 3 times a week, but I admit I sweat a lot, especially during spin classes. I usually wear sneakers, and they get damp pretty often. I haven't always been great about changing them out or letting my shoes air properly. At home, I tend to walk around barefoot, but I've noticed that the floor in my apartment sometimes feels a bit damp.
That's helpful to know, Mihiraa. Have you tried any treatments for this?
Oh, yes. I've been trying so many things. Initially, I thought it was just dryness or maybe trauma from a stubbed toe, so I used regular moisturizers. I even soaked my feet in apple cider vinegar and tea tree oil solutions because I read online that they could help. When that didn't work, I bought some over-the-counter antifungal creams and nail lacquers. But nothing seems to make a lasting difference. The condition just keeps getting worse, especially on my toenails.
Based on what you're describing, this sounds like onychomycosis, which is common. It's a fungal infection that can be quite persistent and often requires targeted treatment.
Oh, I didn't think it could look like this.
It can be presented in various ways. Treating this condition can be tricky, as it requires both patience and consistency.
What kind of treatment would you recommend? Should I continue with those natural remedies?
While home remedies like vinegar or tea tree oil might provide temporary relief, they're usually insufficient for severe cases like yours. Mihiraa, I would recommend a combination of systemic and topical treatments. For systemic treatment, I'd prescribe terbinafine tablets. These work internally to target the fungus but can take a few months to show full results. You'll need a blood test before starting to ensure your liver function is healthy, as these medications can occasionally have side effects.
Okay, that sounds like a plan.
Mihiraa, for topical treatment, we'll use amorolfine, applied once or twice weekly. You'll need to file down the affected nails before applying the lacquer to improve penetration.
Thank you, doctor.
Extract 2. Questions 13 to 24. You hear a neurologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hello, Mihiraa. I'm Dr. Larson Hedfield, a neurologist. Please take a seat. Can you tell me what's been going on?
Doctor, over the past few months, I've been experiencing occasional weakness in my hands, but now it feels more persistent. I also notice that I'm dropping tools at work, which is worrying because I'm a carpenter and use my hands all the time.
I see. Can you describe the condition in more detail?
It's mainly my grip strength. I find it hard to hold small objects, like nails or screws, and my fingers feel stiff sometimes. It's also affecting my arms. There's this odd feeling, almost like my muscles are wasting away.
That must be distressing, especially given your occupation. Mihiraa, have you noticed any other symptoms?
Yes, actually. My muscles sometimes twitch, almost like they're jumping on their own, and I've been feeling clumsier than usual. I even stumbled a few times last week when I wasn't paying attention.
Thank you for explaining that. Have you experienced any difficulty with speech, swallowing, or breathing?
Not really with breathing, but sometimes my voice feels a bit hoarse, and I choke on water occasionally. I thought it was just because I wasn't being careful.
I appreciate your honesty, Mihiraa. These details are crucial in understanding what's happening. Do you have any family history of neurological conditions?
Not that I know of. My parents were healthy, and I don't think anyone in my family had problems like this.
Understood. Let's move on to an examination to assess your symptoms further. Mihiraa, based on your symptoms and what I've observed during the examination, I believe you may have a condition called amyotrophic lateral sclerosis. This is a progressive neurological disorder that affects the motor neurons in your brain and spinal cord.
Is it serious?
Yes, it is a serious condition, as it leads to the gradual weakening of muscles. However, the progression varies from person to person, and we can take steps to manage the symptoms and improve your quality of life.
What kind of treatments are available?
Mihiraa, treatment focuses on slowing disease progression and managing symptoms. We often prescribe medications like riluzole to reduce the damage to motor neurons and edaravone, which may slow functional decline. Physical therapy is also essential to maintain mobility and prevent stiffness.
Will I be able to continue working?
You may need to make adjustments as the condition progresses. Using adaptive tools or considering lighter duties might help in the short term.
Okay, understand.
We'll work with occupational therapists to keep you as functional as possible for as long as possible.
I appreciate your honesty, doctor.